The coronavirus is taking a devastating toll on some of the most vulnerable people in our society. The New York Times points out that 1,100 of the 140,000 developmentally disabled people monitored by the state of New York have tested positive for the virus. 105 have died. That is a far higher rate than the general population. Joining us now to discuss, Robert McGuire. He's the executive director of the Cerebral Palsy Association of Nassau County. Help us understand what is going on in the disabled community.
Well, one of the things that people misunderstand when they talk about social distancing is that when you're taking care of people who need so much hands-on care, that's impossible. I'll give you an example. Many of our people that we take care of need two-person lifts. So two people needed to lift you, me on one side, another person on the other side. We're very close to each other. In addition to that, many of our guys don't know or can't cover their nose or cover their cough. And so therefore, the exposure is there. It's real.
So what are you doing?
Well, in the beginning, if you heard the story, on March 24th, in my 48-bed home, we had 2 vacancies. 10 people went to the hospital and 9 tested positive. That began an onslaught in which eventually 37 of the 46 residents tested positive. And the initial shock of those kind of numbers drew fear through my staff. You mentioned before that not everyone has angels on their shoulders. I would suggest that the people that work in our industry have angels on their shoulders. They have always done saintly things, and now they're doing heroic things. So initially, we didn't have enough PPEs. Many of my staff were wearing garbage bags to cover themselves. We now, fortunately, have been able to procure masks and gowns and gloves, and so our people are better protected. And by being better protected, then they too aren't spreading the virus. But in congregated care, it's not just a family of 5 where 5 people hunker down. In my 46 people living in Bayville, I have 120 staff that would be coming in and out on any given week. In my 8-bed homes, I have as many as 15 staff that would be coming in and out. So the potential for spreading the virus is just that much greater. And our guys, many of them, have comorbidity issues, so they are the vulnerable population, and we are forgotten. One of the messages we'd like to get out in our entire industry in New York State, we're the backbone of the healthcare system, and we're not included oftentimes in the Medicaid increases we have not gotten in 10 years. It's disgraceful. Many agencies talk about small businesses, as you were speaking about just shortly. And I think Brian was talking about agencies or companies that didn't position themselves well for this kind of circumstance. It's impossible to have prepared for this, number one. And number two, our industry, we're working at the threadbare circumstance because of not getting increases. So we're hopeful that Medicaid dollars that might come from the federal government go directly to our industry so that we can pay our staff the combat pay they deserve. Candidly, in my Bayville facility, I doubled the salaries of the people working there. And I did that because they deserved it. They were earning it. And I'm hopeful and happy that Senator Schumer is speaking about getting hazard pay. But hazard pay needs to be given to us now. My first payroll in Bayville was over 50% higher than my normal payroll. I need the money now, 6 months from now.
Robert, I want to thank you. I want to thank you for all that you do. I want to thank your staff. Without a doubt, you are the better angels, and you're the ones leading the way.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me, or click over on this list to see lots of other great videos.